The tongue.
We won't get to, let's finish the nervous system. I don't know if you guys are going to be able to see this upside down, but drop this over here. Okay.
Yeah, I'm tired.
Let's stay okay. All right. Being that this also shows the oral cavity and the nasal cavity, they could ask you possibly some special sense questions. So let's go through the basic information, then we'll go to those. So here you have the dural sinus, which basically is where the cerebral spinal fluid is going to flow within the subarachnoid space. Here you see the gyri and you see the sulci as well. Then you have the corpus callosum, septum pellucidum. This whole area in here, all the way around here, is the third ventricle. On the roof of the third ventricle you have the choroid plexus, which secretes what? Cerebral spinal fluid, which is produced by what neuroglial cell? Epidermal cells. Thank you, Stephanie. All right. Then don't worry about this little pink area here. It leads to this gland, which is the pineal gland. And then this large elevated area within the third ventricle is the thalamus. And this little area here is actually a little scar tissue that is interthalamic, which means it connects both ends of the thalamus. And this is called the intermediate mass. Here, what number is that? Can you see it? 11, 7? 11? 7. 7 is the anterior commissure, which leads into the optic chiasm, which leads into the infundibulum that connects to the pituitary gland. Now, as soon as the infundibulum is there, this whole bottom of the third ventricle is the hypothalamus. That all leads into the cerebral aqueduct or the midbrain aqueduct. And as soon as you get in here, you go into what's called the midbrain. So from about there superiorly and about there inferiorly is the midbrain. And there are three structures in the midbrain. You have the posteriorly is the corpora quadrigemini, which is composed of the superior and inferior colliculus. Anteriorly is the cerebral peduncle, and what separates is the cerebral aqueduct. The cerebral aqueduct connects the third to the fourth ventricle. You can't see it, but there's a choroid plexus in there as well. Once you get into the brainstem, you leave the midbrain to go into the brainstem. So this is the pons. This is the pons, and this below the pons is going to be the medulla, all the way down to about here. Right about where the foramen magnum is, right here, is the spinal cord. Initiates from there. This is actually the cerebellum. What you're looking at here is actually the vermis, which connects both the cerebellar hemispheres. So, but sometimes if they put something here and say ID structure, if they say ID general structure, just put cerebellum. If they say ID specific structure, you're going to say arbor vitae, or you can say vermis. They usually aren't going to ask you the vermis on this because it's not clear.
Can we say tree of life?
Pardon me?
Can we say tree of life?
No.
Why?
You can know tree
So
of
much
life,
easier.
but say arbor vitae. Because I want to teach you guys some Latin.
Spell it.
All right, now once you come over to the nasal cavity, you have to remember that right about here is the ethmoid plate, the cribriform plate through the ethmoid. So they could ask you what special sense structure is going to be involved in the superior nasal cavity. You'd say olfactory, cranial nerve number 1. What allows the air to flow through there to pick up the scents? And you'd say the turbinates, or the superior, middle, and inferior nasal concha that throws the air against the mucous walls. In here, you have the tongue. They could ask you, generally, where are you going to find the papilla? Anteriorly, you're going to find what kind of papilla? In the middle, generally speaking, and in the posterior. Where are you going to find the umami?
Right.
Posterior, right there. Okay? That's about it on that. I think that's all the nervous things we have, isn't it? They usually don't use that other one, that small one, showing
Mama.
the transduction, but it's fairly transferable. Let's do the tongue because it's relatively easy for special senses. Doesn't that really look like the alien in that movie?
Yeah.
Pops out of his chest. Anyway. I bet you this is where they got the idea from. Anyway. So, let's take his teeth out. So again, all these little areas here are the papilla. Generally speaking, you're going to have filiform and fungiform here with the umami on the back, which are circumvallate. Posterior to all that, way back in here is going to be the water receptors that allow you to taste and to differentiate the water. You have sublingual and submandibular. You okay?
Yes.
Sublingual and submandibular salivary glands. You have the thyroid gland here, which is an endocrine gland. What does it secrete? Say loud. No, that's what actually stimulates it to secrete something when it comes from the pituitary. But what does it actually secrete? Once the TSH gets to the thyroid, what does it stimulate it to secrete? What hormones? T3 and T4, which would be close, which would be thyroxine. Okay. Now there are, you can see here, some cranial nerves. You've got a nerve factor that's kind of this here, and here's the same. This one's a little different. So the ones that are going to the muscles that are actually literally below the tongue are going to be referred to as the hypoglossal. So this is cranial nerve number 12. This one isn't clear, so I'm pretty sure they're not going to ask you. But this will be the cranial nerve number 12, the hypoglossal nerve. Okay, because it's part of the nervous system. And I think that's about it. I don't think they're going to ask too much on the muscles for this. They could ask you also what's posterior to the trachea. What is posterior to the trachea? Any ideas? Whoops, wrong way. Posterior to the trachea is, who said? Yes, the esophagus, thank you. Let's try the ear first because the ear's a little smaller. Now remember in the ear, that's definitely this is going to be a little Somebody rescue Wilma.
Oh my
I'm sure
god.
she's okay.
I just totally grabbed your feet.
That was
that was you.
So unfortunately, I can't see much from that angle over there, so I'm going to do this.
Is she okay, little Willie?
Yeah, she's trying to kick me.
I don't
She
blame
must
her.
be okay.
Through the wrong hole. All that.
Okay, we'll start at the external and work our way internally. So this is the pinna and/or the auricular. You still okay?
She's back.
Oh, she is. Okay. And this is the extra. We're missing something.
External.
We're missing the tympanic. Where's the tympanic membrane?
What one? The see-through.
Does that one have one? Right here, right, Jennifer? Let's steal that one for me, Nikolai. Oh, there it is. Someone. No wonder we can't hear. Okay, so put that in there. I'm trying to see if we can hold that gently, stay somewhat. Thank you. Okay. So the external auditory meatus comes in and connects to the tympanic membrane. So what you need to know is the boundaries of the external ear, which would be the auricle, laterally and medially, or superficially and deep, and then deep would be the tympanic membrane. The middle ear would be the tympanic membrane, and, which is very hard to see, right down over here would be the, there you go, your pen. It's actually going to be right there, which is going to be the oval window. Okay, put that back where it belongs. There we go. So middle ear is going to be tympanic membrane to the oval window. Inner ear is oval window to actually the cochlea. Those are the three divisions. Once you get past all this and you get into the tympanic membrane, then you should know the ossicles. What connects to the tympanic membrane is going to be the malleus. What connects to the oval window is going to be the stapes. And what's in between? The incus. Okay. Now, once you actually get to the oval window, there's another window right below it, number 16. This is referred to as the round window. All of this connects to the vestibular structure, or the vestibule inside. The vestibule is what separates the semicircular canals from the cochlea. Once you get into this, then you have to, if you set it back in here, you have to determine the semicircular canals. What is the anterior, what's the posterior, what's the lateral? So you've got anterior, posterior, and lateral. Okay? Because remember, we're looking at the lateral side here, the medial side here. The bone that it sits in is the temporal bone. You have the cochlear. They could also ask you about the nerve. So if they point to this nerve, you would say cranial nerve number 8, which is the vestibular cochlear. But if they see there's a separation there and there, make sure that if it's going to the semicircular canals, it's going to be the vestibular portion of the vestibular cochlear, and opposite for going to the cochlear. They can ask you about this muscle, tensor tympani. They can ask you about the carotid artery. This is the auditory tube, and its function is to
Release.
drain fluid. What else?
It also has a
So
waxy substance.
It is an equalizing pressure mechanism. So when you go up and down at different altitudes, then it doesn't constantly build up some pressure, so it actually releases. Other than that, that's about it on this particular